Well, good morning, everyone. Once again, welcome to another live this morning. We appreciate you coming on when you can and coming on live and saying hello. Our dear friends on this program, much appreciated. Thank you for joining us. As you get your notifications, let's see. Yes, Lynn, you're the first name up from Aurora. Andrea, Niagara Falls. Paul, how are you? From Edmonton, Alberta. Brahim from Portland, Oregon, drinking his coffee. How is you? Rosalinda from Niagara Falls, and it's snowy over there, right? Okay. Kevin, there he is from Oshawa. How are you, Kev? Lorraine, BC, how are you doing? And Brahim is getting ahead of us, saying Happy New Year. Yeah. Judy, New Brunswick. Elaine, St. John's, Newfoundland. Sandy, Fergus Falls, Minnesota. Gloria from windy New York. Georgie, Halifax, Nova Scotia. Madeleine from Kippawa, Quebec. Bonjour. Nellie, how is you? Beverly from New Brunswick. Fran from Orangeville. I always laugh when I see Fran's name because I don't often see it. Hi, Wendy from Markham. Donna from Park Hill, Tadais, Beaumatin, Patricia from Pulaski, Tennessee. How are you? Dave from Muskoka, Eileen from Brampton, Diane from Peterborough, Ontario. And Brahim is saying hi to Kevin. Sandy, Vancouver, Washington. Chaz, how are you? From Maryland. Annette, how are you? Bonjour. Luella, West Tennessee. Diane, Patricia in Florida. Roma, how is you? Vince, good morning. Marianne, Long Island, New York. Heather from Miramichi. Sherry, oh, Sherry, from Mississauga. And Marcia from Arizona. How is you? Mary from Gander, Newfoundland. Rosa, cold up in the cloud. It's cold. It's freezing here. Keith is in Florida this week. Dennis, how are you? Dave, Gail, Mount Pearl, Foggy. Cheryl, how is you? Francis from Vaughan. Guys, and Nativity saying, me. I miss you all the time, Nativity. I don't know why. Milika and Linda. Oh, we love those Lindas. New Brunswick. Meta and Trish. How are you, Trish? John, Elgin, Illinois. 48th wedding anniversary for our friend John. Rachel, Catherine, Maureen in Boca Raton, Florida. Bruno, Marianne, Sharon. I'm going to say hi to Doc McEwen. I don't see her name, but I missed it. I missed it most days. Janice, David, from Jensen Beach, Florida. IT, Judy. Love you guys. Wendy from London. How are you? Bonnie. Couple more, guys. Ida, how are you in Victoria, British Columbia? Wanda from Virginia. Lori Lee. Sandra from Brampton. Are Sandra and saying Jimmy from Brampton? Okay. Lori Lee is in Ventura, California. Patricia from Sudbury. Karen, Sault Ste. Marie. Hi, Maggie. Long time no talk. How are you? Gail saying hello to Brahim. Okay, let's get going, guys. Thanks for coming on. We love you guys. We appreciate you more than you know. Now, hi, Rita. And Dale. I hate to miss anyone. Guys, this story, every once in a while, I come across something and it sort of knocks my socks off, if you know what I mean. It's almost earth-shattering. And this story, or this, what we're going to talk about this morning, what a shift. What a shift. Now listen to this, okay? This is from the American College of Cardiology. They published new recommendations. The American College of Cardiology. I'm holding my breath. It's shocking. They're publishing new recommendations that the CRP test should be done in all patients. To the cardiologists. This is new. Okay? Here's what let me read it to you. Okay? Because I have it right in front of me here. Accumulating evidence over the past 2 decades demonstrates that a biomarker called C-reactive protein, which signals the presence of low-grade inflammation, is a better predictor of risk for heart disease than cholesterol. I want to pass out. What? Are you guys been listening to The Doctor Is In? Okay. Let me read that statement again from the American College of Cardiology. Okay? Listen to what they said. And we'll break this down for you. Accumulating evidence over the past 2 decades demonstrates that a biomarker, okay? You know how much I love biomarkers. If you got my book, Sun, Steak, and Steel, I have a whole chapter on what biomarkers to look for. To educate yourself on blood tests. Demand that your doctor perform these biomarkers when they orders up blood work. Okay? Listen to what it says. The past 2 decades demonstrates that a biomarker called C-reactive protein, which signals the presence of low-grade inflammation, is a better predictor of heart disease than cholesterol. Guys, I never thought I would see the day. Unreal. And I can tell you, almost without exception, there isn't a cardiologist, I know there's exceptions, but generally, this would be shocking to a cardiologist. They're not looking for inflammation. They're looking for cholesterol. Like I've always said, looking for love in all the wrong places when it comes to heart disease. We haven't even made a dent. So now the American College of Cardiology is saying, you know what? We want you cardiologists to order a biomarker on every one of your patients. It's called CRP, C-reactive protein. That's made in your liver. It detects the presence of inflammation in the body, okay? Now, okay, let's break this down a little wee bit so, you guys know this, but let's break it down even more, okay, just for a minute. What causes inflammation in the body? Remember, here's a statement that we've made. I made it at the Martin Clinic for 40 years. I've talked about it on almost every radio show, every TV show, every podcast that I ever did. Inflammation is not Houdini. It doesn't just appear. There's a reason for inflammation. Okay? How do you detect it? Well, if you have pain, you can almost guarantee you have inflammation. But this is a blood test. This is a biomarker. And here's what elevates your CRP. Okay? Acute infection. You have an infection, you have inflammation, it's going to go up. Injury. You have an injury, your CRP will go up. You have an injury, you got a lot of inflammation in one area, right? Like a knee or a hip or whatever. Okay? You know what increases CRP? Smoking. Your body, you got toxins coming in, your body reacts to that. Okay? Even insulin resistance, that's what I've talked to you about over the years. That insulin resistance can be a real stimulant to inflammation. And when the CRP, and this is what 2 decades, what the American College of Cardiology has published, 2 decades of research has demonstrated that chronically high inflammation is very destructive and is a better biomarker for heart disease than cholesterol. Guys, that's hot off the press. That's news. It's news to me that they would even say it. It's not news to me that this would be true. Okay, now let's go on heart disease before we talk about this biomarker. Is very, very good, not only for heart disease. Biomarker, having an elevated inflammation marker, CRP, is a real important indicator inside your body, because usually low-grade inflammation is silent. You don't even know it's there. Because inflammation, you might be thinking pain, but you might not have any pain. But damage, when there's damage, let me give you an example of heart disease. When there is damage inside a blood vessel, your body reacts to that damage. It sends what we call a cytokine storm. The ambulance comes to the area. Your body has an internal ambulance. First responders. They send in the ambulance and the fire trucks and to put out the fire. And so the body first, the ambulance comes and it brings extra blood, it brings extra enzymes, it brings extra protein to the area to heal the area. But inside a blood vessel, here's what happens. What kills blood vessels? I've taught you this, I've taught you this, I've taught you this. What destroys blood vessels like smoking? Smoking, yes, but like smoking. What's as bad as smoking? Sugar. How do I know that? Okay? How do I know that? Because ask a diabetic. What's diabetes? Sugar left unattended in the blood stream. Sugar left unattended in the bloodstream. Sugar destroys blood vessels. It damages, especially the epithelial. Okay? The Teflon layer, okay? Eensy weensy, little teeny weeny layer inside your blood vessels. It's Teflon-like, very slippery, or it should be. It gets destroyed by what? Sugar. Now your body has, you guys know this, your body does everything imaginable to take sugar out of the bloodstream. Remember what I always tell you, it's in the no parking zone, right? And insulin, right? The hormone that your pancreas secretes will not allow sugar to park in the bloodstream. No parking zone, right? It's the traffic cop. Come here. Blows the whistle. Come here. Sugar, what? You can't park there. Don't park in the bloodstream. It just shows you that everybody, you know, your body knows how destructive sugar is. The world doesn't know it, but your body does. It's dedicated to keep your blood sugar levels in a very, very tight range. A little wee bit. Empty your 5 liters of blood. Okay? Take it out. Hold it. Let's start with this. Eat 20 donuts. Don't do it, but this has been done. Okay? Eat 20 donuts. Bad fat, bad sugar. Like 20 donuts, okay? Don't do it. The experiment has already been done, so you don't have to do it. Take your blood sugar reading before the 20 donuts, and then an hour later, take your blood sugar again. And it'll be back to within normal limits. Why? Well, all the sugar that was produced, all the sugar that was in those donuts, they're in the blood, but insulin comes along and says, you there, don't, what I tell you, don't park there. You can't park. Can't park there. Out, 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 out. And your insulin parks sugar in muscles when there's no room there, liver. And when the liver gets all gummed up, the Costco parking lot, it makes more and more and more fat cells to store the sugar in there, glycogen. Okay? So your body's dedicated to that, guys. And diabetes is now, your insulin's not working. You had so much resistance to insulin over the years. Diabetes is the last thing that happens, guys. It's not the first thing. It's the last thing. Your cells can't stand it anymore for insulin. Don't come around. I hate your guts. The bad neighbor. Bad diet, bad neighbor. Insulin, knocking on the door of the cell. Let me in. I got to store sugar in there. Open up. Muscle cells, open up. Liver, open up. Fat cells, I got to put you somewhere. But what happens to that sugar left unattended? Okay, so that was a big preamble to the sugar left unattended. It damages blood vessels. Ask a diabetic. What do diabetics have trouble with? What's their biggest trouble? Circulation. Their eyes. Much more susceptible to glaucoma, cataracts, diabetic retinopathy. All of the above. Why? Circulation, blood supply in behind the eye. Diabetics often go blind. Another area, diabetics, kidneys, blood supply. I brought you podcast after podcast. Why didn't I invest in dialysis? Why didn't I invest in dialysis machines? You'd have as much money as Bill Gates. You know what I mean? Because who would have thought in the 1970s? Look, dialysis has been around a long time, but who would have thought that there's so much need for dialysis? Dialysis is needed because kidneys are failing. Why are kidneys failing? Oh, Dr. Martin, they're eating too much steak. No. Doctors think protein, and when they should be thinking sugar. Sugar destroys kidneys. Ask a diabetic. Sugar destroys blood vessels, so think of limbs. How many amputations? What did I read the other day? Every 30 minutes in the United States, or I can't remember, there's an amputation taking place. Why would a diabetic need to get an amputation? Blood vessels got destroyed. By what? Sugar left unattended. Why is CRP, C-reactive protein, why is that such a good biomarker? Because it measures inflammation, and inflammation's not Houdini. Inflammation goes to a site of injury. What injures a blood vessel? Sugar. It causes that little, like smoking, it causes that little layer within the blood vessel, the epithelial layer, Teflon, think Teflon, slippery, it gets sticky. Because sugar destroys that layer, and the blood vessels get sticky, and the body comes rushing in to repair. Inflammation is repair. The ambulance comes in. The firemen. See, cholesterol. Don't blame cholesterol. It's part of the repair. Don't blame the police because they're at the crime scene. Don't blame firemen because they're trying to put the fire out. Blame sugar. When guys, I read this, the American College of Cardiology published new recommendations to every cardiologist in the USA. Would you please measure CRP? I almost passed out. I read this study yesterday, or when was it? Maybe on the weekend. I almost passed out. Wow. They're starting to get it. Cholesterol's not the boogeyman. Plaque doesn't come from cholesterol. It comes from damage to the blood vessels, from sugar left unattended in a no parking zone. Did I finish the story about the donuts? In an hour, your blood sugar is back to normal. If your insulin's working properly. Now, don't do that to yourself, please. Okay? You have a soda. Insulin comes rushing into those 14, I remember doing this on a TV show once. Bring me a glass of water. Okay, it was already there on the set. Okay? And I had a sugar bowl. And I was trying to demonstrate what a soda is like. I said, you don't see this, but this is how they make it. And I said, they changed the sugar, but I'm not showing you high fructose corn syrup. I'm just showing you sugar. Okay? And I kept going. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. At least. And I said, in some, like a Mountain Dew, keep going. Coca-Cola, Pepsi-Cola, about 10 teaspoons of sugar. I said, okay, the water, I gave it to the host. I said, you want to drink that? And said, no, I don't want to drink that. Of course you don't, but you'll drink a soda. That creates so much damage in a blood vessel, guys. You have no idea. And you can measure it. Because when there's damage, there will be inflammation. Remember, it's not Houdini. So, what is the moral of this story? Get your CRP done. Now, there's other things that elevate CRP. I told you, acute injury. So you have an injury and your CRP is elevated. Well, it's not a good time to take your CRP. Okay? What else? Acute infection. Let's say you got a real bad bug. Well, your CRP is going to go up. Of course, your body's ambulance system's going crazy. You're going through a cytokine storm. Of course. Here's another one. Autoimmune. You have an autoimmune disorder, your body turns on itself, it's allergic to itself, and you get a cytokine storm. And by the way, people with a chronic infection, okay, this is why we talked, this is years ago, I did this on my radio show, 30 years ago I talked about this. The link between gum disease, periodontal, and heart disease. I remember doing this. I talked about it in a few of my books that I wrote. That you get a low-grade inflammation from bacteria in your mouth. And that's why I love probiotics, guys. That's why I love oil of oregano, because it only killed the bad guys. See my teeth? I brush my teeth. Little drop of oil of oregano or two on the toothbrush. It don't kill your good guys. It just aims at the bad guys. Probiotics. You got friendly bacteria in the mouth. At least you should. That's why you should never use mouthwash. Never, never, never use alcohol-based mouthwashes. It kill your friendly bacteria. But there's a link, and this has been proven, by the way, guys, a link between oral bacteria. It starts an infection, but infection, low grade, inflammation within the blood vessels. The body responds. And that's all right. But you don't want it to stay there, because it damages blood vessels. Sugar being the main culprit. Glycation. We talk about that. What does sugar do? Glycates. It hardens. It takes away the slipperiness of the blood vessel. Guys, this is so important. Okay, numbers. CRP numbers should be really at 0. Under 1, good. Okay? 2, 3 and above, you got a problem, Houston. And that's, of course, I've been saying that a long time. But now, hallelujah, what? The American College of Cardiology are recommending to do the CRP test. It's better than cholesterol. That's what they're saying after 2 decades of research. It's a better biomarker than cholesterol. I want you to get your cholesterol numbers. Why? I want them high. Doctors want them low. I want them high. I want cholesterol to be high. Cholesterol's on your side. Okay, so anything above 1 really is you got low grade, and above 3, it's much more dangerous. Now keep in mind, you might have autoimmune, but if you have autoimmune, you're much more susceptible to have a heart attack. Diabetes, autoimmune. And CRP, guys, by the way, get her down. Why? Alzheimer's. Remember what we taught? We teach. Sugar in the brain. It damages your blood vessels. Oxygen. Blood brings what? Red blood cells. What do red blood cells do? Carry oxygen. You don't want to damage those blood vessels. CRP. What do you do to lower CRP? How do you lower inflammation? Well, cut out the sugar. People on the reset. Who's doing the reset on January 1? Let us know. Are you going to do it? You can do it. Go 30 days without sugar. See how good you feel. Change fuels. You can do it for weight loss, but it's much more than that. It will lower your CRP. It will lower your marker for heart disease, even according to the American College of Cardiology. I never thought I'd see it in my lifetime. Never thought I would see it. Okay? And that's why the reset, guys. And we'll talk about that tomorrow. I'm going to go pump your tires on the reset tomorrow. the last day of the year, we're going to pump tires on all the benefits of the reset. Clinically proven. Changing fuels. Okay? So what do? Cut out sugar. Right? Cut out sugar. Make your blood vessels lower the inflammation. Lower inflammation. How do you do that? Right? High DHA. Oil. Lubricate. It puts out the fire too. That's why I love it so much. Vitamin D puts out the fire of inflammation. The sun elevates your nitric oxide, opens up blood vessels, makes more room for blood. Nabitol, pine bark extract, famous for what it does to blood vessels. It protects the endothelial layer, and it opens up the blood vessels. It's an antioxidant, powerful, because it takes away oxidative damage from blood vessels. You have oxidative damage, you're going to get an inflammatory response to that. CRP. Okay. Okay, guys. And just a little announcement, okay? The Thursday will be off, okay, for New Year's Day. On tomorrow and on Friday, Lord willing. Okay, tomorrow I want to talk about doing the reset. Why not? Last day, we can do a New Year's resolution tomorrow. Together. Okay? Have you got your book? Rebuild Your Temple? Man, it's flying up. Well, we don't have it on shelves. We have it on online. But man, is it flying off the shelves. Per se. Okay? Thank you for that. Okay? Thank you for that. That's our audience. Okay? That's us. That's you. Thank you for that. Okay? Tony Jr. and I thank you so much. You want to join our private book club? Have you joined that? We're going to do some good stuff in there. Okay? And in the private book club. You join that. Rebuild Your Temple book club. Okay? Good. Okay, guys, we love you. I think you know that. Do I have to say it? But I will say it. Okay, we love you. And we will talk to you soon.